I'm Dr. Barry DiBernardo. I'm a plastic surgeon in Montclair, New Jersey. Tonight we're going to do a smart lipo procedure of the upper and lower abdomen. And we're looking to remove fat and hopefully get some skin tightened up. We're going to mark the area we're going to do, which is the central aspect of your abdomen. You have some wrinkling of the skin. I'm going to put little squares on you that are an exact measurement because that indicates how much energy each sector is going to get. We need a certain amount to tighten the skin. Then the numbing process is going to be 4 steps. You're going to take some pills.
Yes.
The areas I'm going to enter, I'm just going to numb up like a little bee sting. I'm going to pinch 2 squares together to see the thickness of fat. And it is 26 millimeters. I'm also going to measure the top part, and that is 34 on top. We're going to remeasure this after the case and see the difference in thickness. The reason that's important is because we use a formula of 1 to 2,000 joules per centimeter of thickness in the deep fat layer. The next thing I'm going to do is continue the numbing process. Going to feel another pinch. I'm giving her a series of injections. We numbed the entry point already, and we're just adding some lidocaine into the area to tone down the next step, which is the tumescent fluid. So I've given her some lidocaine in the whole area to start numbing that. Okay, the next step will be the prep. So right now, I'm going to just make, with a number 11 blade, a small poke in the area that was already numbed. I'm going to just spread a little bit. And now I'm going to take the tumescent fluid, and I'll test it. We usually leave it on a slower rate because I'm going to go slowly in a patient who is under local. And now I will start in one corner and start applying the tumescent fluid, which is Ringer's lactate, lidocaine, and epinephrine, and bicarb. The tumescent is going into both the superficial and the deep layer. I'm going deep first because I can then feel it coming upward onto the superficial. In this case, I'm using, I'll call it a moderate amount. I'm giving it enough fluid to provide a good optical cavity because the laser operates in a fluid environment, and also to make sure all aspects of the tissue is bathed in the tumescent fluid. However, I would not call it the super wet technique. Let's talk about numbers. In an area like this, I'll probably put somewhere about 1,000 cc's. We have 12 sectors here. We've marked the patient with our 5 by 5 centimeter sectors, and we have 12. So you could say I'm going to put approximately 75 to 100 cc's of tumescent fluid per sector. But it is not multiple thousands of cc's in this area. It's the same formulation for the whole area or any part of the body. When you start working in the upper abdomen with your tumescent fluid or with anything going in, you feel the fibrous nature of the tissue. That's what you would find anatomically in the upper abdomen, and that's why some additional energy source to break that up is beneficial in the liposuction procedure. Before we came into the room, actually when we were marking the patient, she took 2 Percocet and she took 2 Valium, 10 milligrams each, for a total of 20 milligrams of Valium orally. Here we see the end of the laser fiber. This is going to be plugged into the machine. We're screwing the connector of the laser fiber into the back of the machine. Here's the SmartSense handpiece, and we're going to use this to set up the apparatus. Okay. She is now taking the laser fiber, the 600 micron fiber, slipping it through the rear end and out the front end of the handpiece. The collar is being placed of the cannula. This cannula is 1 millimeter. Tightening the rear end, the laser fiber is now in position, and you can see that it protrudes approximately 2 millimeters. Okay, so there you can see the laser tip. Now we have a sterile bag, and the SmartSense accelerometer sensor is being placed into the sterile bag, and it will then be fitted into the handpiece. The accelerometer is going to sense our hand motion in surgery. If we slow down, it will slow the laser down. If we stop, it will stop the laser. This is one of the protective safety mechanisms built into the system. This is the stripper. Here's the cleaver. The laser fiber is being introduced into the stripper. This has removed some of the blue outer coating. We're now taking a glass cutter to score the fiber and then snap off the excess, and that gives us a sharp edge to the fiber. Here is the handpiece comprised of the laser fiber. I always check, try to see that round circle. We want to see a very nice round light emitted, telling us there's a good clipping. Then we have the cannula, which is 1 millimeter, and the handpiece, which has the accelerometer, SmartSense, built into it, the sterile sleeve for that circuitry, and then the laser fiber coming out the back. I'm just going to finish my tumescent fluid here. Are you comfortable now with this? Are you feeling anything? Pressure, but not pain? Okay, that's good. So we've put a total of 1,200 cc's of tumescent fluid into the patient. I have 12 sectors, so that is 100 cc's per sector. Putting glasses on. One thing we recommend from the safety aspect is temperature control, meaning if we get up to too high a temperature, that could cause blistering or a burn in the skin. We can shut that problem down immediately by having close access to an ice pack. Obviously, we're going to be monitoring temperature with thermal camera or a digital laser-guided thermometer. However, regardless of your temperature monitoring, you should always have that ice pack within arm's reach, ready to put on the patient immediately. Okay, starting with number 1, these are deep settings. Today we're using the MPX multiplexing technology. We're blending 2 different laser wavelengths the 1064 wavelength and the 1320 wavelength. Later we'll talk about how those two work together and why. I'm introducing the laser into one of the previous very small incisions. We're starting with 30 joules on the 1064 and 15 joules on the 1320. We're starting in sector number 1. Here we go. I'm working in the deep layer of fat, breaking up the fat. When you're coming around a bend here, you don't want this laser fiber to torque too much. It can snap, so make sure there's plenty of length to the fiber to have a nice even curve. In this layer, what we're looking to do is break up the integrity of the adipocyte cell wall. It'll fragment it, and it will also work on the vasculature to get coagulation of some of the blood vessels to reduce bleeding and bruising. The 1064 component in this multiplex combination is more important for the blood vessels. Going on to number 9. Okay, we have reached 24,000 joules. At this point in time, we want to clip the fiber again. We found that the fiber can weaken at approximately 25,000 joules, and that will require a clipping for a fresh tip on the fiber. We're not measuring temperature at this point because the deep lasing does not build up enough significant superficial temperature for us to monitor it. When we get to the next step, we will see the nature of the temperature rise on the superficial tissue. I'm right up against the dermis. I'm scraping the dermis and working to build up temperature. It's important to get as close to an even rise in temperature across the whole sector. Not dwelling and moving rather quickly. That's a nice even red color. That's what we're looking for. I use my left hand to give a flat, even surface to the dermis so I can apply energy evenly. It's in this layer that if we have dimpling, skin irregularity, scar tissue, cellulite, we would be breaking it up. If you didn't apply your deeper energy, your temperatures of the deep tissue would be a lot colder, and this would require more energy to heat the dermis. We want a sustained heating. We don't want a quick peak of temperature. There have been previous studies looking at responsive fibroblasts, and those studies showed that at a temperature of 42 degrees, it does not harm them, but it actually stimulates them to produce more collagen and elastin. Some may say, why does my grid look like it's not centered? It looks like it's shifted a little bit. That's because it's easier to approach the walls of the umbilicus, 3 of them from one sector, and then when we get to number 9, we'll hit the far side. Otherwise, you have to go in circles in one sector. Do you have a little scar over here? What's that from? Appendix, right? So we have to pass through that scar tissue. So let's see the effort that it takes. And it is almost effortless to go through the scar tissue, go under the scar tissue. It's breaking right through that scar tissue without any problem at all. We can take our glasses off. We're done with the laser. We've now completed our laser section, the deep laser, the superficial laser. Now we're going to have fragments of oils and cells to remove using liposuction. I'm using a long 3mm cannula. Size of the cannula, in this case, because it's a large area, is a 3. We do have a 2.4. If it was a smaller area, that would be the standard size that we use. Some do laser lipolysis and don't follow up with subsequent suctioning. That's one way to do it. I do remove the cells because I would rather them not sit there and perhaps turn into scar tissue or take longer for the healing process to occur. This suctioning that I'm doing now is really effortless. We have broken up a lot, and when we start collecting in the canister, you'll see a much more compact aspirate because it's more liquefied and broken fragments rather than cells with air spaces in between. There's a very significant difference in what I feel and what the speed that it's removing with the multiplex versus the 1064 alone. This process would take a lot longer to occur with just the 1064. Are you awake?
Yes, I am.
And are you feeling very much?
I just feel that you're inside doing that, but it's not painful.
No pain, okay.
No, not at all.
Can you describe what it felt like when we were doing the whole process?
I could feel that you were in there, but it was not painful. So it's like having local anesthesia at the dentist, and you can feel that it's there, but you don't have pain. So I think this is much better than on the general anesthesia.
Now I'm going in the upper abdomen. This is typically a more fibrous area that requires more effort of suctioning, and I can say that I'm not pushing or pulling any harder up here than I did in the lower abdomen. I've got my 2 fingers just moving it across without a lot of pressure. You may not need additional power tools. And also, where would we have this same type tissue to get this benefit? In the back rolls, that's very fibrous tissue, and also on gynecomastia. Same way with standard liposuction, you start pinching and feeling for evenness throughout, feeling that you've removed the deep fat and the superficial fat layers even throughout your field. That's your end point usually in any type liposuction. It's not particularly difficult to do. You just have to know the sequences. They're not technically difficult to do. And you need to be exacting on your measurements, particularly temperature, and be aware of temperature. But it's really not a difficult set of additions to the liposuction procedure. There'll be a standard set of parameters with each wavelength or combination of wavelengths. In the deeper layers, we're kind of estimating a load of energy in joules based on thickness of fat or cubic fat volume. And in the superficial layers, we're going strictly by temperature. Joules not as important, temperature is most important. How do we know when we're done? I pinch the skin, and basically I just have the thickness of superficial fat left, and I do that throughout the area to make sure we have evenness. It feels pretty even. And now we're just going to close 2 of the side wounds, and there's a lower wound to leave open in case there's any fluid to drain out. We may suture certain wounds if they're in a more prominent location. In the upper part of the wound, we'll put a single 6-0 Prolene suture in that to approximate it. It will look better in the end. Any small incisions that are at the base, we will leave open in case there's any drainage. It can drain from that wound. Now that we're at the end of the procedure, I'm going to use the calipers again. If you remember, we took a caliper reading at the lower part of the wound. Those 2 blocks of sectors, we were 26 millimeters of thickness at the beginning of the procedure. We will put it in exactly the same area and take a reading. and the reading now is 6 millimeters.
Yes.
Okay, she liked that.
Yes.
The upper reading was 34 millimeters. I'm going to come above and below the sectors we were in before, 34 millimeters, and now we are at 9.5 millimeters.
Wow.
So we got a good fat breakup and removal, even in that very thick fibrous tissue. We're looking at our aspirate today. The total aspirate was 1,000 cc's. We put in 1,200 cc's, and the ratio of fat to fluid is 7 to 3. We have 300 cc's of fluid, and we removed 700 cc's of fat in her abdomen. I just want to look at the tension of the tissue right after the procedure. I'm pinching it and seeing its recoil, like so, and also seeing the degree of wrinkling we can get in this tissue, which is an indication of its elasticity. We're looking at it today, and then we'll look at it in the future as well. But it appears as though it has got a good skin tension at this point. We're going to talk a little bit about the dressing we put on. Once the procedure is completed, we take some foam and put this as a compression over the treated area. That's going to give a nice even pressure between the skin and the tissue underneath. Then we take a compression garment and put that over the foam, and that's going to stay on for the next week or so. We like the patients to wear it as much as possible. Obviously they can shower, but when they've completed that showering, put the foam and the compression garment back on. It is good to keep the compression on for the first 3 weeks after the procedure. It's not absolutely necessary, but we like to see compression to reduce any swelling that may occur. And how are you feeling?
Oh, I feel great. I'm very surprised how well I feel.
How long ago did we finish the procedure?
Oh, that was about 10 minutes ago.
And you're awake, you're comfortable?
I'm awake, I'm comfortable, I can walk, and I feel absolutely fabulous.
And you're ready to go home?
Yes, I am.
Now, did you get to see the result after we finished?
Yes, I did, and it's amazing the difference. I mean, my tummy is flat.
Very
Which
good.
hasn't been in a long time.
Okay, good.
Thank you very much.
You're welcome.